So we have 4 trauma bays, or trauma rooms. This is one of 4 of those. There's 2 in the 500 pod and 2 in the 600 pod, which is where we're at right now. They are equipped with doorways in between so that when you have multiple trauma patients at one time, you can have the surgeon or ER doc or whatever staff you need to go back and forth between the 2 rooms. They have surgical lights in them, so when you're doing procedures, they're the same kind of lights that are in the OR, so they don't cast a shadow, and so that you can do your procedure and have the proper light. They have trauma booms, and the booms can go anywhere. So if you needed to do a major procedure, you could pull out equipment on this side, move your patient over, drape it, and have all of your stuff happening on one side of the room and move the boom over there and the patient over there. So it's kind of a nice mobile room. Let's see what else. They're the only 4 rooms in the department that have an exterior door, and that door is for EMS access. They have their own badges. So if the pre-hospital people call in, we can tell them go to trauma 610.
If family want to step out of the room, if we're doing a procedure or something, then the family's welcome to come in here and have a seat. Or if they have some small children, they want to just get away for a little bit without going all the way back to the lobby, then they can have a seat right here. Some of the isolation rooms you can tell by the little white boxes on the outside, because then they'll have reverse flow so that people with airborne illnesses, and it needs to be flown out.
Thank you.
This is pretty much a standard patient.
This is a major room. It's a little bit larger than the standard rooms. It has the lifts in it for patients up to 600 pounds, and it also has the larger monitors. All of our rooms have televisions for the patients, and they're all set up identically with the staff side, universal cards, and then the family side. The newest for us is the call lights. The patients can control their televisions. They can call for water, and then the call light system will have a color. They can call for to use the bathroom, or if they're in pain, or if they just want the nurse, they can call for that. And each button has a different color, so when the HUC answers it, she'll know what they need.